The number of patients being treated for COVID in England's hospitals is now higher than it was at the previous peak in April this year. It's the latest evidence of the intense pressure on NHS services throughout the United Kingdom. More than 40,000 new infections were reported in the UK in the past 24 hours. That's a record as the new variant of coronavirus spreads rapidly. In the south of England, doctors are reporting that the level of patient need is incredibly high. Conditions in many Welsh hospitals are said to be very challenging, while doctors in Scotland say that there's a danger that health services will be overwhelmed. Our health editor Hugh Pym has the latest.
There was a stark message today from Homerton University Hospital in East London. Nurses and doctors are incredibly stretched caring for very sick patients. No one should underestimate the impact the infection can have. One hospital in southeast London has declared an internal incident because of the high number of COVID patients. The Queen Elizabeth Hospital in Greenwich said it was working with health partners and patients were getting the care they needed. Elsewhere in the capital, patient numbers continued to rise, with the variant of the virus found initially in the southeast of England spreading more rapidly. Accident and emergency departments reported intense pressure.
I was on Christmas Day and it was wall-to-wall COVID. So we see patients who are coming in who have COVID symptoms, but we also see other patients coming in with other problems who turn out to be COVID positive. And between that, there is a great deal of difficulty getting those patients through into the wards.
Unprecedented amount of work.
The medical director at one big hospital trust spelled out what they were facing.
Things have been really challenging over the last few days. I suppose the best illustration for that is on Christmas Eve, we had about 170 patients with COVID across our hospital sites. And today we have around 242. So a very large increase has occurred over the last few days.
The number of COVID patients in hospitals in England reached a peak in the first wave of nearly 19,000 in April. Then it fell away during the summer before picking up again from September. And it's now above the level of that previous peak. So what does that mean in practice? Hospitals need more beds for COVID patients and in some cases are moving staff from other areas to care for them. Already some less urgent work is being cancelled. Health leaders say the postponement of more routine operations and procedures will become more widespread.
Sadly, it's inevitable that as the infections rise and the admissions rise, that actually we see disruption to other services. We're desperate, our members are desperate to keep that disruption as low as possible. But unfortunately, some of our elective and planned services will be disruptive, both in hospitals and in other settings as well.
Doctors in Scotland have warned that their health system is severely stretched and are concerned that the limited household mixing on Christmas Day will have spread infections.
Inevitably, there will be a cost for this. One of the things that we're particularly concerned about here in Scotland is that the New Year festivities will shortly be upon us. Of course, there's no relaxation for those festivities, and it is extremely important that households don't mix.
An official at Public Health Wales has said that health services are under enormous pressure in an incredibly challenging situation. A significant proportion of the NHS workforce in Wales is said to be off sick, a familiar story in other parts of the UK. Hugh Pym, BBC News.
Now, teachers' unions in England are warning that mass COVID tests are undeliverable by the start of the spring term, which starts for some students next week. The government has announced that all secondary schools and colleges in England will be able to test staff and students from the first week of January. But unions say a number of issues, such as recruiting and training staff, are yet to be resolved. Today, ministers said they hoped that the staggered reopening of schools in England would go ahead in January as planned. So let's look at the official figures on the pandemic in the UK so far. They show that there were 41,385 new cases recorded in the latest 24-hour period. That's a record. 357 deaths were reported of people who died within 28 days of a positive COVID-19 test. taking the total number of deaths across the UK so far to 71,109. And joining me once again to take stock this evening is our health editor, Hugh Pym. So 2 new peaks today, Hugh, across the UK in terms of the number of new infections and across England in terms of the number of patients being treated for COVID.
Yes, that's right, Hugh. More than 20,000 patients with COVID in English hospitals now, more than that peak seen in the first wave. That's quite a sobering announcement. And in some ways, it's harder for hospitals now because back then they were told to clear the decks, stop doing any routine work and leave all beds really for COVID patients. This time that hasn't happened. They've been expected to carry on doing the routine work, the operations and so on. Although, as we've been hearing, more and more hospitals are having to put that on hold. We should also make the point that one reason there are so many patients with COVID in hospitals is, bluntly, they might not have survived before, but because treatment is better now, there are more therapies, they are still alive, but they are needing more care and therefore they need hospital beds. Now, as for case numbers, that's more than this very big number, 41,000, a big increase. And yes, there's been a bit of a delay in reporting new cases from the weekend, but even so, officials say that is a significant increase. Public Health England have said there is growing concern now about these case numbers, particularly what they mean for hospital admissions in the future, because sadly, some of the people who are reported in that number will become seriously ill and go into hospital and add to the pressure on hospitals at the busiest time in January in the new year. So we've got this very big number now, reflecting infections a couple of weeks ago. The pressure seems likely only to build from here, though of course everyone is hoping for more good news on the vaccine to come in the weeks ahead.
Indeed. Hugh, thanks very much again. Hugh Pym there, our health editor.